Well, we already know that UC Health is the region's most comprehensive brain tumor center for adults. But did you know that about 25% of people may have a tumor in their pituitary gland and not even know it? Well, we talked to a couple of doctors who specialize in treating these sort of tumors. Take a listen.
My name is Ahmad Sadigat. I am an associate professor of otolaryngology at the University of Cincinnati College of Medicine. Here at UC Health, I am an endoscopic sinus and anterior skull-base surgeon.
My name is Jonathan Forbes. I'm an assistant professor of neurosurgery. Here at UC Health, my focus is in minimally invasive skull-base surgery.
Here at UC Health, we take a multidisciplinary approach to determining the best treatment plan for patients with pituitary tumors. A pituitary tumor is a tumor within the pituitary gland, and it is very easily accessible through the nose. With a team consisting of neurosurgeons like Dr. Forbes, otolaryngologists such as myself, as well as dedicated endocrinologists who focus on diseases of the pituitary gland, we come up with a treatment plan that is personalized for the particular patient based on their tumor itself and the needs of that patient.
Patients with pituitary tumors will typically present with one of two types of clinical syndromes. The type of presentation will depend on whether or not the pituitary tumor produces hormone and the size of the tumor at the time of presentation. Patients that present with pituitary tumors will be considered for one of three treatment pathways: observation, radiation therapy, or minimally invasive surgical resection. A large percentage of patients who present with pituitary tumors don't require an intervention. We like to follow them with serial imaging and to make sure that that tumor is not causing any problems. The second type of treatment algorithm that we'll often consider is radiation therapy. And here at UC Health, we have access to a proton beam radiation center. This is one of a handful of centers across the country that has access to this specialized form of radiation therapy for the skull base. The third type of treatment that we'll often consider is a minimally invasive endonasal endoscopic procedure for removal of pituitary tumors. This is a very safe surgery. I'm very fortunate to have a colleague like Dr. Sadigat, who is really an international expert in minimizing sinonasal discomfort following this type of surgery.
Patients with pituitary tumors should choose UC Health for their care for a number of reasons. First and foremost, we have the region's only pituitary center with staff whose practices are dedicated to treating pituitary tumors. We bring an expert level of care to these patients, not only through our practices, but through our research as well. We try to identify ways that we can continue to make this very easy, simple, straightforward surgery even better and more well tolerated by patients. Not only do we practice at the cutting edge, we create the cutting edge.
Well, if you're interested in finding out more, or if you want to schedule an appointment, you can go online to uchealth.com/brain tumor.